The case I choose to research for this particular project was the San Diego VA Hospital research ethics case. A little bit of background on the case. There were veterans at the San Diego VA hospital that were subjected to liver biopsy research without informed consent. This research was from 2014 to 2016 and led by Dr. Samuel Ho. He collected liver tissue, blood, stool, and urine samples from patients suffering from alcoholism and liver disease. However, extra liver samples were taken from the veterans participating in the study during the biopsy without their informed consent. So this is one of the major ethical issues, is that the patients that were undergoing this particular study did not know that an extra portion of their liver was taken out during the biopsy and during the procedure by Dr. Ho. These extra biopsies were not necessary for the clinical care of the veterans, and they were only taken for research purposes, and no one was told about it. So again, the patients were not informed on the extra samples taken or of the increased risk of complications that could arise from this procedure. One of the more severe complications included severe internal bleeding. However, there was more complications that could arise from Dr. Ho taking extra liver samples when he was doing their biopsies. There were two researchers with Dr. Ho, and when they discovered what he was doing a few years after he had started, they did report it. They accused him of malpractice and unethical research. However, the VA neither confirmed nor denied what was happening with this research. They just reported that they were looking into the matter at hand and that they would give more information at a later date when they had that information. Ho did deny these accusations, and it wasn't until 2017 when it was actually brought to court per the two physicians and the two researchers that accused Ho and were working on the case with him. The VA did look into the case slightly in 2017 and stated that there was no substantial danger to the public health. However, the court then urged them again after looking into the case to look further into what was happening in that particular hospital in San Diego. The court did rule that this was unreasonable care and procedures and that the VA needed to take a closer look at the accusations and the case. However, unfortunately, nothing has come about since then. And again, the court and the VA was saying that there was no substantial danger to the public health. However, taking these extra biopsies from the liver and the patients without their informed consent and without them knowing, and then again telling them that, or not telling them that there was no complications and about the internal bleeding and other complications that they could have from the procedure, was one of the biggest ethical issues that I found within this case. For the case outcome, Dr. Gerald Cox is the deputy under the Secretary for Health and said that a second investigation was ongoing for the case. This again was in 2017. And when this was completed, they found that egregious research was being conducted. The independent special counsel's office was then reviewing a second report on the case. And one of the researchers and physicians that was with Dr. Ho, who initially reported the unethical research, was terminated from her position at the VA hospital, as was her husband. So again, this was in 2017, it's now 2019. Not much more has come out on the case or what the case outcome was, other than the two researchers that were with Dr. Ho were terminated from their positions at the San Diego VA hospital, whereas Dr. Ho still kept his medical license and was conducting research further. So again, two of the researchers that reported the case have been terminated from their positions at the VA hospital, and the VA hospital is still denying some of the claims that this has happened per the independent special counsel. So the independent special counsel did look into the case, but they didn't look into it further enough to find that the egregious research that they so-called said was happening is still happening or is not happening, and Dr. Ho still has his particular position at the hospital. But the two researchers that reported the case were terminated from their position. for reporting Dr. Ho. So what was missing in ethics? The patients had no autonomy, so they had no decision making based on what they thought they should do for themselves. The researcher was lacking beneficence because he was doing further harm to those patients by taking those extra biopsies and not telling them about the complications that could arise. There was also no non-maleficence, and there was no fairness or justice to the patients because, again, they had no informed consent for the research and for their extra liver biopsies being taken. Some strategies for the future that I think would benefit this case and benefit the San Diego VA hospital was to gain consent and informed consent when conducting research or performing any operation on patients. Also, if you're going to evaluate a patient in the first place, you need to gain consent. If there are accusations of misconduct, look into them and do not dismiss them without adequate evidence. So the VA hospital is kind of just dismissing the accusations and the misconduct that took place and not really reporting on it further. So they may or may not have the adequate evidence to say, yes, this did happen, or yes, this did not happen. But regardless, if someone is saying something, look into the case further. Educate your patients on what could or could not occur after certain procedures. For example, side effects that could happen, the medications that they may or may not be on, outcomes of their procedure, what the procedure is going to entail, stuff like that. So they have the knowledge of what is going to be going on to their body, and they can then give you the consent or not give you the consent that you need and that they have the right to give you. And then always have more than one person on a research team to aid in ethical decision making and in general, because putting research on just one specific person is a lot, but then there's always going to be that person kind of looking over your shoulder too, saying, are you making ethical decisions for this case, for your patients, for your research? These are my references.